No, she is not a model. She looks like one, right? No, she's not a model. She is a medical doctor, and her name is Dr. Anuoluwapo Adepoju. Yes, but why are we talking about her today? Something happened. You know, this lady you are looking at is dead. Her name is Nneka Onwuzligbo. Nneka died in 2019 after undergoing a cosmetic surgery at Med Contour, a hospital run by Dr. Anuoluwapo. She couldn't make it. One thing led to the other, story after story. At the end, she died. Botched cosmetic surgery. So many other women had issues. People that underwent procedures, one thing or the other, at the same clinic, under the same doctor, they had issues. So she even had, at a time, her hospital was closed down by the government because of series of litigations and everything. But there are clips that I have included there. If you watch them, you eventually find out what happened. But before you see the clips, if you are here for the first time, you are welcome to my channel. This is Ozike TV. I hope you are doing great. Please take our time to subscribe to my channel, like and share this video and other videos that I have. Just take your time and go through our videos. All right, so you're welcome. Thanks for stopping by. I really appreciate you. So watch these clips. I will be right back.
May her soul rest in peace. She did not die in our facility. She had the procedure done. She had the pneumonia, and that was why she went to Lut in the first place. She walked to Lut herself. She was in Lut for over a month. They made her sit on a lie on a bomb, discontinued antibiotics medication, which is a problem which may make the patient resistant to that particular class of antibiotics. This patient was mismanaged in Lut. Lut should be the one answering certain questions on how they managed this patient for over a month, and she died. As a doctor, as a physician, on my part, I did my best. However, I do not. Patient was fine. She didn't have any post-op complications. She was doing okay. She had breathlessness. She had a pneumonia, and there is evidence to show that she did not have fat in her lungs, fat embolism or pulmonary embolism. Now this is a medical condition, and I referred to them in Lut because they have the respiratory unit and they could manage such conditions. I had no idea they were going to mismanage the patients, so they discontinued her drug. She wasn't on it for some time. She was on her bomb. She was supposed to turn frequently or not sit on the bomb, but then they had to make her stay on the bomb. They do not have experience in this aspect of medicine, which is the aspect of cosmetic surgery. It is not yet a popular field. People don't really know so much about it. Only a few people do it in Nigeria.
Different people are coming out to accuse Dr. Anu, who is a self-proclaimed plastic surgeon, for performing failed surgeries on her patients. A lot of Nigerians are putting the blames on these ladies, asking them why do they want to go and change how they were created in the first place. This has led us to a different topic, which is to ask this pertinent question. As a man, would you approve of your wife to undergo liposuction? What are the other ones?
Just cosmetic surgery.
Cosmetic surgery. The women that are going for liposuction are people who feel like they don't look attractive anymore to their spouses, and they want to fix that. Can they be blamed for that?
No. Let's separate the issues. Yeah. A man who wants to cheat will cheat.
Exactly.
It has nothing to do with the wife. Nothing, absolutely nothing. Because the thing is, we have been designed in our different body types. We've been given this pattern, our different body types. And so we've been given allowances for when childbirth comes. And it's not even only married women who do. Most of the people who've been doing this plastic surgery are young people who are not even married.
We need to recognize that people have different needs, and that even though it may be hard for us to understand or comprehend because we're not in their shoes, there are people who it has helped physically, yes, as well as mentally. And because of that, that is why there's a market for it, because those people recognize that there are people who would need it because it will make them feel better. So we'll put that aside.
It has nothing to do with the third party.
No,
it's about them.
Yes, about them. I have decided this. This is something I've heard of stories of people who are really buxom ladies who have saved up every year to make sure that they can get it reduced, so that they can fit better into their clothes, they can take the pain off their backs. We have people who have always wanted to look nicer in their jeans. When I wear my jeans, I don't want it to be flapping at the back. I want to feel my jeans.
Yes.
And they put their monies together, and there's nothing that you tell them. So having said that, the fear that I have in Nigeria is that in Nigeria, we judge them. And because we judge them, we're not very careful to accredit the people who are meant to be doing this. We're not careful to make sure that the people who are providing these services are qualified. And when malpractices happen, where people are dying on the table or they're getting botched surgeries, they are left to just, they're left to their, so they're left alone, and then either they handle it or they pass on. So that's what is more serious to me, that even though we don't accept it, there is a market for it.
There is a market.
There are people for it, and our system, our especially the medical association, has to make sure that the people who are providing these services are meant.
Thank you, Mariam, for taking us there, because that's the problem. That's where we're heading to. The people that undergo these surgeries are judged, and because of that, they don't get the right adequate attention. But people do it for the right reasons. Not because, they feel they want to look better for their husbands, but it boosts their confidence.
I graduated from College of Medicine, University of Lagos, and I had further training in the Soto's Family and Surgery Center in Texas. Also, I trained with American Academy of Cosmetic Surgery, and we had the last training in Orlando, Florida, at Advent Health Nicholson Center, Florida. Also, I had trainings in hair transplantation and liposuction at ST's Center Plastic Surgery Center in Istanbul, Turkey. I also trained in Botox, fillers, and modern implantology, veneers. I've also had other trainings in non-invasive cosmetic procedures and aesthetic procedures as well. I also have a training in beauty therapy. I'm also an alumni of Enterprise Development Center of Lagos Business School. The drama started in 2019 when we performed a procedure on a lady who passed on. So she had the surgery done with us. The surgery was successful, and I think about 3 days after the procedure, she had some respiratory symptoms, and we referred her to a center that had a respiratory unit, for expert management. And she was there with them for about 31 days, and she later gave up the ghost. May her soul rest in peace. Now, it was said online that I performed the procedure alone, and that it was my first time of doing surgeries, and that I just tried my hands on the surgery. I was alone in the theater, and the sister of the patient walked in and found her sister's body lifeless on the table. This is false, because first, the patient was awake for surgery. They also said we transferred fat into the patient's lungs, that she had an embolism. The patient never had an embolism.
What was she in for? What did she come in for? What was she supposed to?
She came in for a cosmetic procedure. I cannot exactly go into the details of what happened, but the surgery was successful. The procedure was done while she was awake, and I wasn't the only person in the theater. I had assistants in the theater. There were other doctors in the theater. nurses, anesthesiologists, anesthetic technicians, and other supporting medical staffs, you know. And she was fine after her procedure.
The hammer eventually fell on her. The Medical and Dental Council of Nigeria, MDCN, has suspended Dr. Anu from medical practice after she performed cosmetic surgery on a client who later lost her life as the procedure allegedly failed. That was Nneka, that lady you saw her picture there. According to the Cable Lifestyle, the cosmetic surgeon who runs the Med Contour Services Limited, a medical facility in Lagos, was arrested in July over the death of one of her clients. In a statement, the FCCPC lauded MDCN's decision to impose interim measures suspending the accused surgeon pending full and final disposition of disciplinary proceedings. Well, you see it. She cannot practice. She cannot be a doctor now. Well, she looks like a model. Maybe she should just take up modeling as a career until they determine her case. Well, if you want to have this kind of procedure, it's proper you look for someone that is known in the field. You know, there are people that are cheaper, but they cannot give you what you want. It's your body. So you don't have to do something that will keep you in pain. It's not even cheap. 1.something million, 2 million. Look at that Omoti. She has spent so much money. If she had traveled abroad, I'm sure maybe she would have gotten something better. Cheap is not always best. Now what will she be doing? What about all these people that she has maimed? What about that Nneka that died? It's not worth it. If you want to do something, do it well, do it right, do it the right way. Or was she in a hurry anyway? Well, that is it. If you want to do something like this kind of a procedure, look for an expert. At least get testimonials. Ask people, ask questions. Who has this person treated? Who has this person, who has he performed this operation on? Find out. Don't just give yourself to somebody that you heard, oh, she's a medical doctor. Oh, she will be telling you, okay, look at my shape. Don't you like the way I look? I can make you to be like this. And people will be deceived. It doesn't help matters at all. Help yourself and stay away from these people. And if you hear that someone has this kind of issues, why would someone hear that, oh, this person performed this operation and it didn't go well and you still went there? You want to test it? You want to test death? Other people were lucky. Well, they are still sick. But this other lady, she died. So save yourself this kind of stress. Okay? Well, that's it. You have seen Dr. Anu. You have seen what happened. Well, that's life for you. Well, I hope you enjoyed this video. Kindly give it a like. And thanks for watching. I will come again with another interesting video. Until then, bye.